Well, we're joined now by Lord Kerslake, who recently resigned as chairman of King's College Hospital NHS Foundation Trust in a kind of protest, didn't you, at the underfunding of health services. Good morning to you. Are you very clear in your mind that the health service is in crisis, or is there something in what Theresa May is trying to say, that it's the time of year, we were planned and prepared for it, and it's not as bad as some of the images we've seen have made it out?
No, I'm afraid the NHS is in crisis, and it's not just a winter crisis. And many people are saying this across all of the health service and indeed all the political parties. We have a fundamental issue about the NHS, and basically it's we're not putting enough money into it. We need a health service that can withstand winter. It comes every year, it's not a surprise. And every year we struggle, and every year, and this is the crucial point, we struggle a bit more. This year, unprecedented, we're putting back normal operations that will be done, things really important to people, hips and so on, that are being put back by a month effectively. That's not good enough. And people deserve better.
Well, the reality is as well, it's not actually been that cold a winter yet. We may yet still have a very cold snap through January and February, March, but it's been relatively mild, so we haven't seen the cold weather yet. What the Prime Minister will say is there's more beds available across the service, there's more resources than ever are being put into the NHS, and there isn't a finite pot.
Well, look, there are more resources going in, but they're not matching the growth in demand. And the general view is we need another 4 billion on top of the 124 billion that's going in now.
From where?
Well, in the end, we'll all have to pay for it. I'm very much in favour of a Royal Commission that will engage in a debate with the public to say what kind of NHS do you want, how much you're going to pay for it, and how do you want to pay for it, basically. We need to have this conversation with the public because...
So you're suggesting some sort of tax, potentially, so people would see an NHS tax?
Look, there's very few things that are more important to people's lives than their health. It touches everybody. I bet you everybody in this programme in some way or another has been affected by the NHS. And so it matters what people will say. So you think
maybe people would pay?
I think they would. I would. It really matters to me that we have a good health service, and in many ways we have one of the best in the world. But it risks slipping away from us unless we do something now.
Well, have viewers at home saying we do pay already. We pay in our taxes towards all sorts of things. In amongst that is for our NHS service. And you're asking us to pay more. Is it not the fact that actually at some point the NHS needs to look at this and make itself more efficient? And there are certain areas where they have to sort of tighten up, whether that's on the acquiring of food or the acquiring the essential materials and the use of tools and stuff, all of which you want them to have, but actually allow the hospitals to run themselves more independently so they can actually go out and make things more cost effective.
Well, you're quite right. We need to carry on improving the efficiency of the NHS. And by the way, it's not just about the NHS, it's about social care as well. It's what we have in home care and what we do in our residential homes. But actually, the NHS has been getting more efficient, just under 2% every year. That's more than the private sector is achieving at the moment. So yes, efficiencies are being made, savings are being made, but it is not enough to meet the rising demands.
So when you were chairman, what were the biggest challenges for you? What was the kind of straw that broke the camel's back?
The big challenge we faced was, first of all, we inherited some big financial issues from merging with another hospital, which itself had got into trouble. Second thing we had to do was to balance this emergency need that was constantly pushing the elective services. Third challenge is staffing. We are 30,000 nurses short in this country. That's not going to be solved overnight. We need to invest in the staff of the NHS and make sure that they feel valued. What you're seeing at the moment in the press is staff saying we basically cannot go on covering for the problems that the NHS faces. And they're coming out and saying it on your programme and elsewhere, and we need to invest in them as well.
One of the reasons why I ask is because there have been some suggestions since you resigned that in fact you were asked to consider your position a couple of days before your decision to resign over poor financial performance at the Trust.
Well, look, I've not got into a tit for tat on this issue. Because what's really important for King's is that it moves on. What I would say to you is three things. First of all, it was my decision and mine alone to stand down, and it was for the reasons I said. Secondly, King's saved big sums of money in the last 2 years. at twice the national average. And thirdly,
not enough.
Not enough, because we inherited a huge financial challenge from a merger that went on, as I said earlier. But thirdly, the feedback from staff and from people and governors in the area to me resigning was really, truly humbling. People were very positive about the role I played. So let's focus on the issue, which is about the funding of the NHS, not on individual hospitals. You showed Stoke earlier on. Stoke is struggling, so is King's, so is every other hospital in the system.
So give us a clear proposal from you then. You're not now longer chairman, so you're free to speak as a free man without any worry at all. What would you propose? Are you saying a tax that we'd all pay for the NHS, a sort of standalone tax so we know where our money's going
I'll tell you what I think we need to do. First of all, we need an immediate injection of funding. I'm afraid the Prime Minister just saying thanks isn't enough. We need more money, and we need it now, and we need to start planning for next year, never mind this year in terms of the impact. Secondly, we need an independent commission to look at our health and care system and how we fund it. And if that comes out with a hypothecated tax, I would support that. And thirdly, we need to recognise that despite these problems, we still have a cracking NHS.
Yeah, undoubtedly.
You know, let's not lose sight of it. My daughter is having her first child in the spring. That's not something that can wait for a month. I'm fantastically proud. She'll go to King's, and I know they will look after her very well. So let's keep it in perspective.
Yes.
But in the end, we've got to put the money in.
OK.